Welcome to your pre-op orientation class at St. Mary's Medical Center. I'm Lisa Boyd, I'm your orthopedic navigator. I am here Monday through Friday, 8 to 4:30 with any questions you have before, during, or after your hospital stay, and you may reach me at 816-655-5354. Please read through your full orientation binder, as this is a shortened version of full orientation class. If you're watching this, it's probably because you've had a joint replacement before and just needed a refresher, or you weren't able to attend the class. So again, please read through the binder. The most important thing I can tell you about this process is this is a journey to wellness. You are not here because you're sick, you're here to improve the quality of your life. You're up, bathed, dressed in your own clothing, participating in therapy, and it's up to you to do the exercises to get back to where you want to be doing your activities of daily living. Education is key, so congratulations to you for being an active participant in your care. The more you know what to expect and what will be expected of you, the better you will do in the long run. Starting today, or when you come in to the hospital, is we're going to do your pre-op testing. You'll get lab work and EKG to make sure everything looks good. We do this ahead of time because it's very important to make sure that you're cleared for surgery. When you're on the operating room table is not the time to find out that something was going on. Finding a coach and support person is a loved one, family member, someone bound by marital duty to take care of you. They are there to help you just like the hospital staff. We will push and encourage you to do everything you can on your own and then step in and help you with the part that you need help with. Your pre-op exercises are on page 11 of your 3-ring binder, and these are really important because they help get the blood pumping in your legs, strengthen up your muscles. Both legs, each exercise twice daily. Again, those are on page 11 of your 3-ring binder. 2 weeks before surgery, it's very important that you make sure that you have been seen by your primary care physician. If you have seen a cardiologist or a pulmonologist, which is a heart or a lung doctor, you need to make sure you're cleared by them for surgery. Again, when you're on the operating room table is not the time to find out that you had something going on. So please make sure that all your physicians know you're planning to have surgery and that they do not want additional testing prior to surgery. 1 week before surgery, we do talk about medication safety. You do need to stop taking aspirin, Aleve, Excedrin, ibuprofen, and prescription anti-inflammatories such as Mobic. Those will all thin out your blood, which is not what you want to do before surgery. You also need to stop taking vitamins and supplements such as fish oil, glucosamine, and chondroitin. If you take an iron pill or a potassium supplement, please continue to take those. If you have any questions regarding your medications, please contact your surgeon. Getting your home ready. You need a clean home with clear pathways for safety and infection prevention. If that is not your home setup, please discuss it with me and we will make other arrangements for your discharge. You need to make sure that you have an area in your living room and your bedroom where you can keep everything you need within reach. You need to have a comfortable chairs with arms are a lot easier to get in and out of. Bathroom safety, you need to assess your bathroom. Do you need a shower bench or a shower seat so that you're conserving energy when you're in your shower? Do you need a toilet riser to help you get up and down from your toilet? If you have questions regarding this equipment, we can discuss that at your appointment. 3 days before surgery, do not shave from your belly button down. No lotions, creams, or ointments from your belly button down. I always tease patients that we're happy to take care of you and your dry, hairy legs. Okay? Do not have any open cuts, sores, wounds on your legs. Anything that pops up, I have people who get yard work done ahead of time and they end up with cuts and bruises. If you have any cuts, wounds, open sores, or anything that looks infected on your legs, you need to call your surgeon's office right away. The day before surgery, please drink plenty of fluids. You can eat like you normally would. Other than the medications we previously discussed you stopping, you can take your other medications like you normally would. The day before surgery, you also want to pack your bag. This is a wellness program. You're going to be up and dressed in your own clothing. Hospital gowns are for surgery. or for sick people and you're not here because you're sick. Loose pants, shorts, something baggy, something if you're having a knee replacement, something you can easily pull above your knee. Shirts, whatever you're comfortable in. Undergarments, whatever you're comfortable in. Okay? You can bring your own toiletries. I can provide you with anything but hair conditioner. If you do have a walker, please bring it with you so we can make sure it's adjusted properly for your height. We are not responsible for personal items at St. Mary's Medical Center, and your consent to be treated by the hospital does say that. Don't put anything you want to keep on your food tray or in the bed next to you because someone will take your food tray or change your bed linens. That's how items get lost. The most commonly left behind item is the cell phone charger, so please make sure it goes home with you. The night before surgery, you're going to do a HibaCleanse shower. HibaCleanse is an antimicrobial soap that will be provided to you. The night before surgery, you're going to get a clean towel and a clean washcloth. Half of that bottle on your washcloth, scrub from your neck down everywhere that you can reach for 5 minutes, and then rinse. Dry off with a clean towel, put on clean pajamas, sleep on clean sheets. Do not use that soap on your hair or your face. If it gets in your eyes, it burns very badly. The day of surgery, nothing to eat or drink after midnight. You can wake up and take blood pressure, heart, or heartburn medication with just a sip of water. Just enough water to get it down. No coffee, no chewing gum, no cough drops. You may brush your teeth. Take a shower. Again, repeat the same process. Another clean towel, another clean washcloth with half the bottle of soap. Scrub from your neck down for 5 minutes and then rinse. Dry off with your clean towel. Put on clean clothes. Arrive at St. Mary's 2 hours prior to surgery, okay? I will warn you, 6 a.m. is the earliest you can be here. So if you're a 7:30 surgery, show up at 6 a.m. You just need to leave your bag in the car. Just bring in you, your photo ID, and your insurance card. When you check in at the front desk, they'll then send you to the pre-op holding area, and it's hurry up and wait. You will meet with the anesthesiologist. You'll meet with your surgeon. They both will fully talk to you and answer any questions or concerns that you have. After surgery, you're in the recovery room 1 to 4 hours, just depending on how well you wake up from anesthetic. Some people wake up bright-eyed and bushy-tailed. Some of us don't wake up that easily. You're going to arrive to the floor, and your family will be notified when you're coming up to the floor so they can go out to the car and get your items and then come up to the floor. Goals for the day of surgery include managing your pain, drinking fluids, and starting to eat. After surgery, you will not be pain-free. We want you to start thinking of your pain on a 0 to 10 scale. 0 is no pain. 10's, if I were at home, I would go to the emergency room. 4 or less is considered tolerable pain. We want you to start asking for pain medication in that 5 to 6 range. By asking for pain medication early, we're hoping to keep you out of the 8 to 10 range. Pain medication, anxiety medication, medication to help you sleep, something if you're nauseated can all be given to you. You have to make sure you communicate with your nurse though. If you need something, please make sure you ask for it. Constipation is a common problem after surgery, and I mentioned it before surgery and people kind of giggle. After surgery, it is a struggle, and no one laughs after surgery. They kind of understand. So please make sure you're drinking plenty of fluids and eating lots of fiber. So a fruit, a vegetable, or a whole grain with each meal. We will put you on a stool softener twice a day. Your surgeon recommends you take a laxative twice a day while you're at home, or a stool softener. A laxative can be provided to you as needed. So a stool softener makes it easier to go. A laxative will help make you go. After surgery, we have a daily schedule. So the first day after surgery is post-operative day 1. So this is the day after surgery. Lab comes around at 3:30 in the morning, and I know you think, why on earth does the lab come around at 3:30 in the morning? But your surgeon's round early, and they do need your lab work back. If you have an orthopedic office that uses residents, those residents round between 5 and 6 in the morning. From 6:45 to 7:15, we do want you to order breakfast. It can take up to 45 minutes to get your tray. By ordering early, then you're not still eating when therapy comes to work with you. From 8 to noon, you'll get morning medications. You get up, do a sponge bath, get you dressed in your own clothing. You'll have physical therapy in your room, and you'll be up to the chair. You want to be up to the chair as much as you can during the day, okay? It's good for your lungs, good for your bowels, good for your circulation. Up to the chair for lunch. Also, 1 to 4, you're going to be up in the chair again. You'll have your afternoon physical therapy. After your afternoon therapy is a good time to go back to bed and take a good nap. We have some rest and quiet time where we try not to bother you as much during that time. 5 to 6 is up to the chair for dinner, and then 6 to 9 p.m. medications and getting ready for bed. And just so that you guys know, the nurses do change shift at 7 a.m. and 7 p.m. Post-operative day 2 is mostly the same. Lab comes around bright and early. Order your breakfast early. 8 to noon, morning medications, sponge bath or a shower if you're ready for the full shower. Group physical therapy in the sunroom. So therapy will come get you and they will walk you to the sunroom for group therapy. This is important because it gets you out of your boring hospital room. You get to interact with others who are going through the same thing you are. Up to the chair throughout the day, especially for lunch. From 1 to 4, you'll have your afternoon therapy in the sunroom and then go back to bed and take a good nap. Back up in the chair for dinner, PM medications, and getting ready for bed. After surgery, this is the 3rd day again, okay? So this is your goal for going home. A lot of times people say, oh, I'm going to spend 3 days in the hospital. Think of it as 3 nights, okay? So your 3rd day after surgery is your goal to go home. Lab work in the morning, order breakfast through room service, morning medications, do a shower if you haven't already had a shower. We do want to make sure you can shower safely at home. Group physical therapy in the sunroom, up to the chair for lunch. Afternoon group physical therapy. And then we do have some rest and quiet time. We do request that you stay for your 2nd therapy session. Get as much therapy as you can when you're here and then go home after your afternoon therapy. If you do have stairs to get in or out of your home or get up to your bedrooms, physical therapy will have you go up and down stairs before you go home. Journey to wellness continued. When you go home, it's all about balancing your rest and activity. You want to perform 20 minutes of physical therapy exercises 3 to 4 times a day. If you try and get up and do everything in the morning, you're going to be so miserable you won't be able to move the rest of the day, okay? Continue to do your breathing exercises that we're going to give you when you're here. And your first 2 exercises on page 11 of your binder, the ankle pumps and the quad sets. You'll also do those 10 times every hour. Eat a balanced diet with plenty of fluids and fiber to help prevent constipation and plenty of protein, and that's important for healing. For a hip replacement, if you're having a traditional hip replacement where they go in through the side, you need to remember your hip precautions. If you're having an anterior hip replacement, you will not have hip precautions. Knee replacements, no pillow underneath your knee. Remember to do the pillow underneath your heel 1 hour, 3 times a day to help get that knee straightening. Incision care, keep it clean, keep it dry, don't put anything on it, don't get it wet, okay? You don't want to do any hot tubs, bathtub, pools for 8 weeks, okay? When you shower, please cover your incision. You can get in the shower when you get out, remove that cover and pat any moisture dry. Take your blood thinners every day until they're gone. You want to try and take them about the same time every day as well. Keep a notebook handy and keep track of how much pain medication you're taking. So what are you taking, what time, and how many pills? That's going to help you know when you're always due for your next dose of medication. It's also going to help you realize how quickly you're going through your medication. Every Wednesday or Thursday, look at your medication. Do you have enough to last you through the weekend? If the answer is no, then you need to call your pharmacy or your surgeon's office to initiate that refill. Do not run out of your medication over the weekend, as the majority of your pain medication cannot be refilled over the weekend. Thank you again for being an active participant in your care and joining us for your orientation class. Again, I'm Lisa Boyd, and you may reach me at 816-655-5354 with any questions. Please read through your 3-ring binder, as that also includes anything in the full orientation class.